I am joined here in the speaker studio with Dr. Susan Thomas, Director of EMEA Google Health. Susan joined Google Health after more than 15 years of consulting to the health and life sciences industry, most recently as a senior partner at Ernst & Young, a clinical lead at Google with the health AI team. She also oversees much of Google's work into the NHS. Dr. Susan, welcome to the studio.
Thank you so much for having me.
Pleasure, absolute pleasure. And I know we've been working you hard. Yesterday we've had you on a couple of sessions so far over on the stages. Yesterday you did Tackling Health Inequalities with Technology. If anyone did miss that session, tell us a little bit what you were talking about in that session and the main sort of key points.
For sure. So that was a great 40-minute session where I was joined by our partners from South Yorkshire. So Google Health has entered into a long-term collaboration with the South Yorkshire region, working with the universities, hospitals, Integrated Care Board, the mayoral authority, the local authorities, plus voluntary organisations to really start to tackle health inequalities across South Yorkshire through working together, thinking about things like digital skills and how we can bring technology into play. And so the presentation or the conversation, fireside chat, was between Gavin Boyle from the ICB, David Crichton, the Chief Medical Officer of the ICB, and Tim Chico, who's the Director of the Digital Health Hub there. And it was super, just really thinking about why that partnership and that collaborative working that we're bringing is really starting to have an impact across South Yorkshire.
Okay, what are the sort of main or key outcomes you were hoping people would take away from that discussion? Any sort of key learnings or points got brought up?
I think so. One is it takes a village. You can't do this on your own. You can't just do this as a hospital. You can't do it as a politician. You can't do it as a private sector organisation. But actually bringing all of these partners together in collaboration is what's going to make a difference. And I think it's important that sort of the sweet spot of public services, academia and research, and then industry is where the magic happens. And that's what we've got going there. So that was takeaway one. Takeaway two is we're really going to need to focus on skilling people up in this new digital age we're living in. Everybody's got a smartphone. People are really au fait with how using those, etc. But as more tools and technologies come into play, we're going to have to help health and care workers feel really comfortable about using those tools, but also helping them teach their patients how to use those tools as well, because otherwise we'll leave people behind.
Okay.
And digital exclusion is something that we're all really focused on, that we don't leave people behind as this revolution is happening.
Is there a real sort of specific skills gap then, you think, at the minute, or is it sort of different backgrounds are more, or demographics are more affected than others?
Yeah, I think there is, like I say, most adults have a smartphone. You know, the vast majority of adults have a smartphone. We use technology to do our banking, to book our holidays, to go shopping, etc. So actually, many of the basics are there, but then health hasn't quite reached it, and people are nervous about their data and so on. So a lot of this is about reassurance, letting people know that we know at the end of the day, health is a human endeavour. Just because you're using technology doesn't mean you're not going to have that connection with your doctor or your nurse or your physio. But actually, how do we help you build that into your system? And I do think, you know, we've moved in as doctors and nurses. I'm a doctor by background. From sort of a paper system increasingly to a paperless system, but it's clunky, it doesn't always work efficiently, we have to go in and out of systems. So this is about giving people the confidence to use those tools comfortably.
Okay, fantastic. And in terms of the other session, have you done it today already?
We have.
AI in health hackathon, or the hackathon final.
So much of our work, everybody's work, is often mundane and a bit tedious. You just get through each day, and then you have moments that are transformative. And our hackathon that we've done is one of those moments, okay, I think, for a few of us. So about 6 months ago, we came up with the idea and sort of floated it past NHS England and John Quinn, the CIO of NHS England, of running a hackathon using Google's cloud and AI products to hack together sort of ideas and solutions that could be put into the NHS easily to transform things quickly and really have an impact.
Just explain to us what a hackathon is for the less
I will.
technologically friendly or familiar audience out there.
I will. So let me tell you how it played out, because that will we'll get there. So
Brilliant.
we put it out, 300 people applied, we whittled it down to about 130, and about 3 weeks ago, those 130 people came to our offices in London and spent 2 days with us. We split them into teams. There were 16 teams of around 6 or 7 people each, and they basically spent a day and a half using our tools and technologies to code and build ideas to change the NHS.
Wow.
And they range from things like teaching doctors or giving doctors opportunities to practice how to be more empathetic with their patients, through to how do we improve patient flow in GP surgeries, through to how do we help staff at hospitals access their HR policies more easily, etc. It was astonishing. Genuinely, the ideas that came out of that room over those 2 days of people who were doctors, data scientists, HR managers, you name it, all sorts of different people thrown together. Some of them didn't know each other before they got in the room, and they came up with these ideas, and all 16 ideas were brilliant.
Wow.
We had judges. They had 90 seconds each to present to us. A panel of judges, including myself, a couple of others. Deloitte were there as our partner in this. And we shortlisted 5 teams who then, over the next 2 weeks, worked on their ideas, put better presentations together, and then presented today for 5 minutes each. We had a people's vote in the room. Judges went off, judged, and we had a gold, silver, and bronze. It was very Strictly Come Dancing. But the plan is, once we're through an election period, that we will then be working on how do we take these ideas forward and actually get them there and working. And we'll work with them, Deloitte will work with them, and NHS England will, with these winning teams, to really drive these forwards. It was genuinely a highlight of 2024 for me.
Wow. And in terms of, I know you said there's so many different ideas coming out. Did you give like certain teams different areas to cover, or was it just free reign?
We sort of gave them some parameters, which were make sure you're building something that's doable, right?
Yes.
And we marked them on feasibility and achievability. Okay. But we said, don't try and build something that's going to take 3 years. It's going to need to go through loads of regulatory processes or whatever. Build something that we can get going in the next weeks, months, 6 months. Yeah. Ideally, that we can really measure the benefits of it. But then they just basically came up with their ideas, and there was all sorts of different things. And it was great to see the passion and the energy. And even like the 11 teams that didn't get through to the finals, they're still thinking about their ideas and working out how they're going to take them forward. So we've really seeded something that could be amazing.
But just in terms of speed, that must save months, if one team's working on a single thing, you just bash out ideas in a couple of days.
We hope so. And we're now thinking with John Quinn from NHSE and others, is there a way that we can replicate this so that we get more ideas, we can get more seeding and things moving quickly?
Fantastic. And what are some of the biggest changes you think technology can bring about in healthcare overall?
Well, I guess we've touched on some of that in the conversation we've had already. We know we are seeing a revolutionary change since generative AI has sort of exploded into consciousness over the last 18 months or so. So I definitely think we'll see AI increasingly incorporated into how healthcare is delivered and into how consumers are using healthcare. But also, I think even simple things like apps on phones, how you're thinking about wearables, healthcare pathways, can you really start to use digital tools and technologies to help people look after their health in a different way? Those are all things that are just starting to happen, and we'll see increasingly as we move care upstream to try and keep people healthier longer so they're not in hospital so much.
Fantastic stuff. And final thoughts from you. I know you've been at the show, you've got a stand in the exhibition hall. How's the show been for you? How's been your experience so far?
Do you know what? I feel like I've got a slightly Richter's grin on, like kind of aching jaw from smiling and talking for 2 days, but it's been fabulous. We've been delighted to be a sponsor of or partner with NHS Confed Expo for 3 years now, and this year undoubtedly has been my favourite year. the vibe, the relaxed nature in the room. We feel like part of the furniture, which is what we want to be. We want to be known for being helpful in the NHS and being here to bring the best of Google to the NHS. And it feels like people are coming to us with that ask, how are you going to work with us, which has been super. So I've really loved our time.
Brilliant, and I say it's lovely to have you as part of the furniture. So thank you
Well,
very much
thank
for
you
coming
so
and
much.
supporting for the last 3 years.
Thank you.
Dr. Susan Thomas, thank you very much for joining us in the studio, and I hope you have a fantastic rest of the show.
Super. Thank you for having me.
There we go, ladies and gents. Stay tuned. More guests coming your way very soon.